The coronavirus versus the 1918 Spanish flu. Spanish flu is estimated to have infected 500 million people in the world, or 1/3 of the total population, and it killed more than 50 million people. Two reasons for this tremendously high infection rate were lack of transparency, poor healthcare. Most of the world leaders knew about Spanish flu and its high infection rate, but due to engagement in the First World War, they hid and suppressed the information, resulting in 500 million people becoming infected, a worldwide infection rate of 33%. This, coupled with poor healthcare at the time, contributed to a 10% mortality rate for all those infected. Most of the deaths were among 20 to 40-year-olds, both from the primary infection and from lack of treatments for secondary infections. Coronavirus, the initial mistake was not understanding the coronavirus sooner, which allowed it to spread and develop into a global pandemic. The reasons why the coronavirus will not be as bad as the Spanish flu. The world is relatively transparent now. The healthcare system is much better. We understand the coronavirus much better than the Spanish flu. What works to fight the coronavirus? Social distancing, increased testing. Since there is no definitive treatment for the coronavirus yet, and because this virus is so highly contagious, social distancing is the key to reducing both the spread of disease and the loss of life. Increased testing helps identify infected people, significantly reducing the chance of spreading the virus to others. Transparency, social distancing, and the wise use of modern medicine hopefully will keep the infection rate of the world population to around 0.5%, which is much lower than the 33% infection rate of the Spanish flu. These measures should also keep the mortality rate to around 0.01% of the world population, which is 270 times less than the Spanish flu, which claimed 2.7% of all human life on the planet. Most of the people who develop the symptoms describe them as fever, dry cough, aches and pain, and loss of smell and taste. If you believe you might be infected with the coronavirus, please call your primary care provider, family doctor, or your local emergency room for further advice. Thanks for watching.